Welcome to Contemporary Retirement. Contemporary Retirement is a public interest program focused on the retirement community. Every program has segments on legal, financial, and health issues affecting the retirement community. Contemporary Retirement is sponsored in part by a major grant from the Family Heritage Trust Company.
Contemporary Retirement is sponsored by Family Heritage Trust Company. The Family Heritage Trust Company is an independent bank chartered trust company established by local professionals to provide fiduciary services including fee-based investment advice, trust services, retirement planning, and tax planning. The Family Heritage Trust Company is committed to client service in our communities. For more information, call the Family Heritage Trust Company at 301-631-5900.
Contemporary Retirement is sponsored in part by a grant from R. Thomas Murphy & Associates, P.C. R. Thomas Murphy & Associates is one of Franklin County's leading law firms, emphasizing estate, trust, elder law, and medical assistance planning.
Welcome to the Is It Legal feature on Contemporary Retirement. Is It Legal focuses on the legal issues affecting the retirement community. With me today is Tom Murphy from the R. Thomas Murphy Law Firm with offices in Waynesboro, Chambersburg, and McConnellsburg. Welcome to the show, Tom.
Good morning, Mike.
Tom, we talked a little bit last week about one of the most dangerous documents in the medical legal system today, and that is the difference between an emergency treatment document, an order for life-sustaining treatment, Polston, Pennsylvania, Maryland versus Maryland order for life-sustaining treatment, and people think this is a living will.
Exactly, and they talk about them interchangeably, and they're two distinct things, and people are being handed these things and expected to fill out things even though they don't have a diagnosed illness, they're not in hospice or any other end of life.
Well, I tell people every day there's only 4 instances that I would agree to this document in advance. Number one, you're on hospice, you've already said that's enough, let's call it a day, keep me comfortable, that's fine. Then you would agree to no extraordinary treatments. Occasionally you'll have a family member who has advanced dementia. There, you know, as we say, Elvis has left the building, you know, there's nobody
sadly,
there.
yeah.
And so you may make a decision not to do anything extraordinary. In my family situation with my mother a number of years ago, she rejected dialysis. Well, you reject dialysis, you're dead. It doesn't matter that you could be treated. You've rejected a life-sustaining treatment, at which point it's okay to say, I'm not going to do anything. And I had a family member many years ago who was 98 that said, don't touch me. I don't care what it is. Don't touch me. I'm out of here.
Exactly.
Well, in that case, in those 4 instances, you would do that document in advance without knowing the specific diagnosis. Terminal illness, advanced dementia, rejecting a life-sustaining treatment, or just simply saying, I'm done.
Exactly, and so those are controlled situations where it makes sense. But just to do this blanket statement that don't give me any treatment, it doesn't make sense because you may have something that's completely recoverable from.
I had a client several years ago who was in the emergency room on a holiday weekend. The holiday was Monday, and the doctors start demanding that they agree to a reduction of treatment. And our instruction to clients is, if you don't fit one of those 4 scenarios, it's fully treat. I want everything.
Exactly.
And so, you know, there was a significant haggle with the medical providers. On Tuesday, the hospital training people came and said they don't have to do this thing, but the providers were convinced that they did. And the interesting thing is, this was Saturday night in the emergency room. Wednesday, he went home. And the answer is, if he's going home on Wednesday, he's getting everything Saturday night.
Exactly. Why guess in that situation? With the medical skills and the technology out there, they can fix you most times. But if you've identified one of those 4 scenarios, like you did earlier, well, then it's a different ballgame.
And so the reality is, we have people in all of these continuing care retirement communities, in these nursing homes, in assisted living, all of whom have one of these documents, and the vast majority of them saying, don't do this, don't do that. Well, excuse me, you don't know what's wrong yet. And yet, you know, we go over a living will, and they pour over that living will as if they're afraid that they're going to, you know, be terminated early. In the meantime, they got some document sitting there saying, don't treat me even though I don't know what's wrong. That's the one they need to worry about.
Well, exactly. And Pennsylvania's got a pretty rigid format, but people are being given these things where it's not appropriate. When I say a little pink paper, I want to know more information because it may be the worst thing they could have signed.
And they don't realize it's not a living will. It is an emergency treatment document. Right. You are restricting the treatment that you're going to receive when you don't know what's wrong, unless you're in one of those 4 scenarios that we identified earlier.
Right. Sounds like a bad gamble to me, because it could be the wrong answer.
Well, I like the Pennsylvania scheme for it, because it does have a bracelet or other things, that, you know, but our problem is in Maryland is that people don't sign this document in Maryland. Now, I understand they do sign it in Pennsylvania, but in Maryland, it's just questions that a healthcare provider is asking you. They can fill that thing out, you don't consent to it, and it's put in your file. And most people, I tell them, you know, if you have any sense that there's something in there, you should demand to see it, make sure that it conforms with what you want. And for most people that are our viewership audience right now, have no business having one of these things.
Exactly. And so you need to be much more proactive in talking to your doctor or your medical providers or anybody you've interacted in the medical profession to make sure you haven't done something not knowing your rights and the rules.
Well, you know, I got people every day say, well, I don't want CPR, and I kind of look at it and say, well, why not? And say, well, they'll break some ribs. Well, first of all, I did CPR without breaking ribs for a long time, and they can probably still do it. But number 2, you know, if that person's good to go for 5 more years, well, you know what, I'll take my chances with a couple broken ribs. You know? Yeah,
and so if you're outside of those 4 areas you discussed earlier, you really got to take a hard look at it, and most times it's just absolutely not important to sign that.
4 areas already on hospice, fine. You are, you know, advanced dementia, there's nothing left, fine. Rejecting a life-sustaining treatment, fine. So old that you don't want to be treated anymore, fine. But if you're not one of those 4, you should be getting everything.
Absolutely. And then you can make a good informed decision.
Tom, as always, thanks for taking time to appear on the show.
You're welcome.
More from Contemporary Retirement after these messages.
Few things in life are as important as family. Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
Every life that meets its end leaves a heart for love to mend. Sister, brother, family, friends are left to carry on. When the loss seems more than you can bear, it's nice to know that we'll be there at Douglas A. Fiery Funeral Home. We care.
Call Ed Lowe to help put your mind at ease.
Welcome to special guest feature on Contemporary Retirement. This segment focuses on various issues which are of importance to the retirement community. My guest today is Dr. Gina Pervall, who is the Chief of the Maryland Department of Transportation Motor Vehicle Administration Medical Advisory Board. Welcome to the show.
Thank you.
I hope you get paid on the length of that title. But you know, one of the great concerns as we have is that people are aging is desire to continue to be independent and the desire to be able to continue to drive.
Yes. Yes, we realize that that is a big concern for our older drivers, and that is the goal of the MBA, is to keep the driver driving for as long as possible and driving safely.
And that's really the key. And oftentimes when we've had the Maryland Department of Transportation on, there is a perception that their goal is to deprive people of their privileges, when in fact it's not.
Correct, it is not. What we want to do is we want to assist the driver, we want to assist family members, physicians, anyone who has a concern or would like some advice or assistance in determining physical fitness regarding driving.
All of us as citizens want everybody to have capability of driving within, you know, the vehicles within safety limits and so forth. But the reality, as we age, sometimes there's some compromises in our skill sets.
Correct. And there are areas that we can control as drivers. We can control the car, meaning when I get into the car, does it fit me correctly? Am I sitting high enough? Are the mirrors adjusted correctly? The seat belt, we can control that. And we can control ourselves, meaning our ability to reason, remember, and react. And it may be necessary as we age to take a refresher course. For many, it's been decades since they've had a driving test, had any type of refresher skills. So that is a good resource. We also have resources where we can measure cognitive functioning to see if there's any impairment there that could compromise ability to safely drive.
And sometimes it's not a cognitive awareness, although we'll talk about that as well, but perhaps it's leaving more distance between you and the car in front of you to address the fact that your reactions are not as quick as they once were.
Exactly. And what I find is we address so much as we age. We plan, maybe that's a better way to say it. We plan on retiring from employment and making changes to accommodate ourselves. But we don't make plans as we age regarding driving as we age, and maybe considering what may happen if we get to the point that we cannot drive. But we need to be aware of factors that could indicate some concern with driving, like you say, driving too closely, becoming confused while driving, parking difficulties, that could be a sign, and of course getting lost while driving.
And as you say, planning sometimes means making sure you design a route that you're comfortable with and using that route rather than trying to create new routes when you're already challenged with other issues.
Exactly. And discussing with your family, discussing with your physician, any changes or concerns that you may have. And it could be, the route could have changed for many reasons. So rather than trying to navigate that on your own, getting someone to assist you so that you can make adjustments so that now you have a more familiar route.
All right, so we have a concern, and that concern may be manifested by a family member or perhaps a physician. What happens?
So physicians, family members, law enforcement can report to the Medical Advisory Board and ask for assistance in determining the fitness to drive.
Now, do I have to tell them that I'm turning my mom in because I know she's not driving very well?
You do not. You do not. We do have family
She
members.
might change the will on me.
We do have families who report, but they want to remain anonymous, and we respect that. So what we do, if we get a report such as that, and that can come by fax, it can come by email, it can come by phone, then we just start an investigation. We just ask for information. We ask for information from the treating provider regarding if there are any health issues that could affect the ability to drive. We may ask that the driver undergo a screening for mobility, vision, cognitive impairment. That can be performed at the MVA. We have branches throughout Maryland which do that. And we also can recommend a formal driving assessment. And that's where someone who is specialized in driver rehab will sit with you, take you on a drive test in a sense, and then give you immediate feedback as to where they see concerns. When we get all that information back, then what we do is make a recommendation. A recommendation may be nothing, continue driving, and maybe check with us in a year or two to see if we should reassess skills. We may make recommendations to restrict nighttime driving or restrict highway driving. And then in cases where we are sure it's unsafe for the driver or the public, we may make a recommendation that the driver retire from driving.
Last resort, though.
That's the absolute last resort, because we have so many resources to assist someone in keeping them driving for as long as possible.
Dr. Pervall, I want to thank you for taking time to appear on our program.
Thank you.
More from Contemporary Retirement after these messages.
Tranquility at Fredericktown Assisted Living and Memory Care provides a warm, home-like atmosphere that promotes daily life enrichment. At Tranquility, our medical director is a geriatric physician. Our professionals support and understand the various stages associated with Alzheimer's and dementia. We have on-site physical, occupational, and speech therapists, as well as around-the-clock licensed nurses. For more information, give Tranquility at Fredericktown a call today, because everyone deserves great care. Let us do the caregiving so you and your loved one can embrace life again.
All right, let's get this show on the road. Ma'am, give me a good push.
Hang on, just 1 minute.
Ma'am, I need you to push right now.
Honey, you really need to push.
It's time.
Just hold on a minute.
No, right now, one push, ma'am, one push.
Just one more bid on HurleyAuctions.com.
If you haven't visited HurleyAuctions.com, you don't know what you're missing. Whether you're buying or selling, antique cars, tractors, boats, or real estate, you can do it all at HurleyAuctions.com.
Get to know Dr. Carrie Hesley at Diagnostic Imaging Services.
What I find most rewarding is caring for women through our Women's Imaging Center. We have a caring staff that will ease patients through an ultrasound, bone densitometry, breast biopsy, or mammogram. Our health team is sensitive to emotions involved in women's imaging and understands that every woman is at risk for breast cancer. Providing the community with a center that is so dedicated to breast health and the imaging needs of women is something special.
DIS Women's Imaging Center, providing women with progressive care.
Welcome to Contemporary Health Scene. Contemporary Health Scene focuses on the health issues affecting the retirement community. With me today is Dr. Bethany Rommel, ophthalmologist, Ludwick Eye Center. Welcome to the show, Dr. Rommel.
Thank you for having me.
You know, Ludwick Eye Center is a big facility, does a lot of different types of treatment, cataracts, various types of eye issues and so forth. But you've also developed something that I have never heard of, which is a Center for Excellence in Dry Eye.
Yes, we're very fortunate to serve our patients, many who have been suffering with symptoms of dry eye for a long time.
And it's really much more prevalent than I had any idea of. Approximately 30 million people, 10% of the population, are suffering some form of dry eye, and yet half of them are in fact receiving any sort of effective treatment for it.
Exactly. A lot of people feel that heaviness and that sandy, gritty feeling is normal as they age, or the blurry vision that comes and goes is just something that they have to deal with. Those are actually signs of dry eye.
So it's a combination. In fact, it's a comfort level in terms of the symptoms affecting, but it also is adverse in terms of effectively seeing as well.
Absolutely, absolutely. Vision is affected, comfort and day-to-day activities can be affected by symptoms of dry eye.
Now, I know one of the situations you were talking about here is it's not readily diagnosed. Too often it's missed.
Absolutely. Not only is it missed because folks don't realize that that's actually what they're dealing with, but it's just receiving the appropriate level of
treatment or care for
and
let's take a look at some pictures here so we can kind of get an idea of what we're talking about. Now, for me, I didn't even know that there were three. What the heck is this? 3 layers on the eye.
Right, so this is the tear film. This is the liquid that's on the surface of your eye, and it's made up of 3 different layers. And this picture, right side being the normal side, the left side being the disease side, is the glands that make the oil part of that tear film.
All right, so that's what is actually, when you blink, is then spread across the lens then.
Across the cornea, absolutely.
Right. And so we see some white stuff here. What's that?
Right, this is crusting, known as blepharitis. This is a sign that there's some buildup of bacteria on the lashes, which can definitely cause some dry eye.
And then we see here the white squiggly stuff among the red. What's that?
That is the plugged up oil glands of the lid, also which makes it difficult for the tear to be effective.
And so when you have any of these sorts of afflictions, then, so dry eye is then saying that you're not getting the appropriate lubrication, the lenses are not being essentially, I guess, kept clean and wiped and so forth, and then dry itself is obviously aggravating.
Absolutely. Redness can be a problem, like we said, fluctuating vision, discomfort.
All right, so a person's experiencing these, and you've said before that oftentimes they go to multiple sources of medical treatment and it's not effectively diagnosed. So if a person watching this program is really having a sense of eye irritation all of the time, what should they do?
You should be properly diagnosed. Someone who's willing to take the time and look carefully at the surface of the eye, at the eyelids and lashes. Listen to the environment that you live in so that they understand what you're dealing with on a daily basis. Can very much help make the diagnosis.
And so because you're ophthalmologist, you know, the person that might be doing your regular eye exam, an optometrist or so forth, may not be fully qualified in order to make this kind of a diagnosis. If you're experiencing, they should be calling Ludwick Eye Center to get a consult.
We have the radar and we are looking for patients who are frustrated by this to help them.
And as you were describing some of the treatments too, it sounds like, you know, it's the diagnosis is as much of the problem. The treatment itself, some of it doesn't seem like it's that dramatic, but it would certainly improve quality of life.
Absolutely. New treatments have been coming out in the past few years that are available and that are helpful to folks. And as the treatments are coming forward, people are paying more attention and, you know, feeling like they can do something about it.
So don't put up with the discomfort.
Please
Ludwick Eye
don't.
Center,
Please
you have
don't.
a specialty group in this, and so you have offices in Chambersburg, Waynesboro, and Hagerstown.
Correct, yes.
Thank you, Dr. Rommel, for appearing on our program.
Thank you so much.
More from Contemporary Retirement after these messages.
The Community Foundation strives to be a forward-thinking organization.
We are assessing needs, working with donors to see things differently,
so that Frederick County can be its best. It's a wonderful place for all of us to live, work, and play.
We look forward to addressing the future needs of the community.
Visit frederickcountygives.org and learn how you can start to see things differently too.
Albright, Crumbacher, Mal & Idell are a full-service firm that provides elder care services including managing incoming bills, bill payment, depositing checks, balancing bank statements, and preparing, planning, and filing personal tax returns. Put your mind at ease and call us today.
Welcome to the Making Sense feature on Contemporary Retirement. This segment focuses on various financial issues affecting the retirement community. With me today is Christian Wright, President of Wright, Gardner Insurance. Welcome to the show, Christian.
Thank you, Michael.
You know, we deal with this modern economic world in which we have 800 numbers and we have internet numbers and so forth. And the public is under a serious misconception that somehow that's a cheaper way of doing business.
Yes, and that's something we battle every day. I mean, the reality is there's not a large spread for between insurance premiums. I mean, there's just not that much different.
Well, you know, I know you don't want to say it, but I tend to find as an outsider that it's 10 to 15% max commission on this stuff. And if you look at the amount of advertising the people that are doing it over 800 lines are doing versus standard carriers, they got to be consuming most of that spread. So any possible advantage is probably not real.
Exactly, and again, that's very misleading. Because as you know, we've talked with your viewers, I mean, having that independent agent, having that agent that actually can speak with you, tailor a program to meet your specific needs is what that difference is all about. And so, you know, if you're buying something off the internet, you're calling an 800 number, you're going to get a cookie cutter approach, and you're going to, the difference in premium is just not going to be that much. If it is, then you need to ask why.
Well, why is always substandard products? There's no magic here. You know, your carriers are all using the same databases for automobile accidents, houses burning down, burglaries, everything else. There's no magic. So the reality is when somebody quotes a substantially lower premium, there's always one answer. It's a substandard product.
Exactly. And by substandard, we're talking about lower limits, most likely, or they're cutting coverage somewhere. And it may not be the primary coverage you're looking at, but it may be one of those other sub-coverages that are really important, but they're only important when you have that loss. And when you find out it's not there, I'm telling you, it's definitely not worth it.
And I say somewhat tongue-in-cheek, and I look at our audience as virtually everyone watching our show, this means you are completely unqualified to evaluate one policy to the next. And when you're making those decisions yourself, whether on the internet or talking to someone on an 800 line, you're almost certainly the blind leading the blind.
Exactly. And that's one of those things that, again, you have a professional available to you, you have an independent agent, you're not going to pay any more for that. But use them. That's what they're there for. That's what they study for. That's what they have certain degrees in. That's what we do day in and day out.
And I'm stunned at how many people do not understand some of the ramifications of some of the decisions that they make. Virtually every carrier, for instance, wants a different premium if a vehicle is being used for business use as a part of its regular use, and yet people somehow think that they're gaining by not telling the company that it's being used for business use.
Exactly. The premiums, it's all statistical data, right? It's all probability. So if there is a difference in premium from business use to personal use, there's reasons why, and that's because there's more likelihood of that vehicle being in an accident. But here's the thing, if you aren't honest to your insurance agent and you don't have it insured correctly, you're only hurting yourself. Because when that claim happens, that's when the insurance is so important. And that's when that company's going to turn around and say, wait a minute, you weren't truthful to us.
Well, we have another element of the same thing. You know, people think that somehow they're gaining by not telling the insurance company about improvements. Now, they all pat themselves on the back that the tax assessor has not figured it out. And I kind of look and say, I really don't care about the tax assessor. The problem is if you've built on, you know, closed in a porch or you've finished a basement, that adds substantially to the replacement cost of that house, and somehow thinking you're gaining by not fully insuring it is delusional.
Right. You're actually hurting your own investment. I mean, here's the thing. You put the money into it. If it burns down, don't you want to have that investment back? Because if it's not, if you don't tell your agent and it's not added to the policy, you're not going to have coverage. And the reality is, Michael, as we've talked before, to make that addition to your policy, the cost, the premium cost is so insignificant. You're only hurting yourself.
And then you have an agent that's your agent. So if they're doing their job right, they're asking you questions. What's going on? What do you have? You know, for instance, I tell people on jewelry, you have 3 choices. Insure it, I don't care what happens to it, or put it in the safe deposit box. There are no other options.
That's exactly right. And that's one that we talk to clients all the time about. And scheduling jewelry is so important. I know we're running close on time, but the reality is you want to schedule any valuable jewelry. And yes, you need appraisal. You need to prove the value of it, okay? But schedule it, because if it just mysteriously disappears, the insurance company is going to pay you if it's scheduled. If it's not scheduled, you have no coverage.
And one of the big challenges here is once you have it scheduled and the insurance company's accepted that valuation, they can't back away from it.
Absolutely not. And they're going to write a check for that amount.
And so agents, not 800 numbers.
People. Use professionals.
Christian Zais, thanks for taking time to appear on the show.
Thank you, Michael.
Thank you from Contemporary Retirement.
Remember a more carefree time? Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
These days, it seems like everything's online, and filling out claim forms and receiving and paying bills online isn't always easiest. That's why we at Quality First Insurance encourage you to just give us a call. Let us help.
Hi there, I'm Paul Sweeney with Quality First Insurance, and it's still just this simple. Our offices are open every weekday where you'll be able to call and speak to real, live people.
No detail was missed. I'm so glad that I turned to Quality First Insurance.
I've recommended Quality First Insurance to my friends who've been just as satisfied.
If you're not happy with what you're paying for Medigap, or more importantly, not happy with your service, give us a try. We're locally owned, and we take the time to provide you with the best. We are Quality First Insurance, and our mission is to provide quality products to quality people. Pick up the phone and give us a call today at 800-745-1411.